within the legislature.
Thanks for watching TMA's Legislative Hotline for Friday, March 22nd. I'm Brent Anier. New this week, a big step for the Senate and House budgets. Testimony on 2 end-of-life care bills, and doctors speak out on a proposal to change the Texas Medical Board's review process. A bill before the House Public Health Committee this week would threaten the Texas Medical Board's procedure for reviewing complaints against physicians. TMA past President Dr. Bruce Malone told the committee that under House Bill 286, specific expert reviewers would be identified to physicians under investigation. The concern is that this would drive out good doctors from the process, leaving essentially only hired guns willing to participate as experts. This would increase expense to the board and lessen quality of the process. Dr. Malone stressed the need for a strong yet fair medical board and said, "Good peer review is brutally, intellectually, and ethically honest. It demands some protection for the process, but more than that, it demands that good doctors take time away from their practices, their patients, and their families to participate in this kind of peer review." Dr. Malone is one of several hundred physicians who participate as expert reviewers. He considers it a professional responsibility to ensure quality care for patients. The bill was left pending in committee. Just past the midpoint of this session, lawmakers examined end-of-life care. TMA testified on 2 bills before the Senate Health and Human Services Committee. Senate Bill 303 by TMA physician member Senator Bob Deuel amends the Texas Advance Directives Act. It allows patients to state their care preferences before a critical and often emotional end-of-life situation. The bill would protect patients from pain and suffering from forced medical intervention in their final stages of life. It also extends patients' time to transfer to another hospital. Plus, physicians are not forced to violate their morals or ethics. TMA physician leader Dr. Arlo Weltge told senators the most important thing is to comfort the patient.
We need guidelines, we need a process, we need a framework that we can rely on that's driven by a third-party independent group of observers. But this is not really about death. Death is inevitable. This is about caring for a person in their final stages of life. Very much as physicians, it may not be that we want to render invasive treatment, but we always are available to care for the patient. And that care includes sometimes hydration, nutrition, pain control, but it may not always include invasive, sometimes painful, sometimes harmful procedures that are not really in the best interest of the patient.
SB 303 is backed by the Texas Catholic Conference, Texas Alliance for Life, Texas Hospital Association, and TMA. TMA Alliance member Representative Susan King is carrying the companion bill in the House. TMA also testified in opposition to another Advance Directives bill. It would undermine current law and interfere with doctors' ability to exercise medical judgment, possibly even forcing pain and suffering on terminally ill patients. The House budget bill took a small step while the full Senate passed its own 2014-2015 spending bill. The Senate version totals $195.5 billion with a $5.5 billion increase in spending. The bill allows spending increases in mental health services, the Physician Education Loan Repayment Program, and graduate medical education funding, which is a top TMA Healthy Vision 2020 legislative priority. However, it doesn't restore all of the GME funds cut last session. Dr. Gary Floyd, former chair of TMA's Council on Legislation, says adequate GME funding helps the physician workforce and it's fiscally smart.
It is so vital that we increase our residency slots. And the reason is because our medical schools have expanded. And as they've expanded, they have outgrown, the graduates have outgrown the number of first-year medical or first-year residency spots that we have available. This year, in fact, in May, when they graduate, we'll have 60 more medical school graduates than we have first-year residency positions. That means at least 60 would have to leave our state. And after making an investment of $168,000 to $180,000 per student over 4 years, that's a huge investment to lose to another state. I say lose to another state because chances are where they train, 80% of those residents will stay within 100 miles of where they train. So if they go out of state, the chances of getting them back to Texas are less likely. And we've lost that investment.
The House Appropriations Committee also passed its version of the budget this week. Their bill allots similar amounts for GME funding as the Senate version. The full House will take it up in early April. Eventually, the House and Senate will hash out a compromise budget. Okay, so before we go, have you scheduled your TMA First Tuesdays at the Capitol trip yet? Join your colleagues in Austin, Tuesday, April 2nd, for a legislative lobby day. If you're TMA family, you're invited. But residents and students, this one's especially for you. That's it for now. I'm Brent Anier with TMA. Thanks for watching, and please join us again next week for TMA's Legislative News Hotline. See you then.